Meeting is being recorded.
That will allow us to respond, well, a little bit more nimbly and reduce anxiety and requirements on providers in particular. We are working on some staffing options as well, knowing that eventually there's likely to be a COVID positive at one of our facilities. And what do we do in response to that in terms of ensuring that we have enough staff to keep our young people safe and the staff safe. So we're going to walk through what we have done to date and what we are asking for in terms of permission, and then we'll seek your guidance about other things that we need to be doing to support you, and we'll go from there. I just want to thank you all. The work that you do is incredibly important. It was before this started, and we value the resources that you provide our state, the services you provide our young ones. You know that we have been trying to strengthen our relationship with BRS providers since this agency was created. And so we're just very thankful for your engagement and your support for these kids. We recognize that you're going through an incredibly stressful time as a provider, and we hope that today's call can both answer some questions and give you some sense of certainty about where we're going. So I would like to now turn it over to Steve Grilly, Director of Foster Care Programs at DCYF, to talk through some of the things that we are doing. I would also like to acknowledge that our communication out to our own staff that are in the field is about these changes is also happening at the exact same time. So we're doing our best to keep our staff informed of all these decisions as well as our providers, but just appreciate that in these times, relying on these imperfect technology tools, that we're just doing our best to have this communication go out consistently and in parallel. We don't always hit the mark, and I apologize in advance for that. So with that, I'll take a moment and pass it over to Steve for a discussion about the things that we are pursuing to reduce, inspections and other things like that, just areas where we are seeking relief and in our operations and our approach to you. And with that, I will turn it over to Steve.
Thank you, Frank. Can you hear me, Frank?
Yes, I can, Steve.
Okay, just checking. It's difficult to know if I'm off mute here. But I wanted to thank everyone for calling in this morning and echo Frank's gratitude from the department to all of you for the work that you're doing, particularly during this very stressful time for all of us. I know that all of you are on the front lines caring for children directly. And as Frank said, we'll if you haven't already, we'll be facing some times where there might be an exposure. It's very anxiety provoking, and we are just wanting very much to be flexible and as supportive as we can during this time. I'm going to take some time to run through some of the things that we've already done, as well as some of the things that we are still working on and planning. And I know that I have a number of my colleagues on the line as well. I know that we have our team members from licensing are on, as well as some folks that work in the BRS, on the BRS team in my division. So I may be calling on those folks to participate as well if you'd like to flesh out any of the points that I'm about to make now. Most of this that I'll put forward, I believe you've received in a recent communication from the department. I just want to go over some of these things, and then we can open this up to additional questions. So things that we've already implemented, we've worked on developing some guidance for foster care residential facilities to respond to the novel coronavirus. And that's something that was put together with the Department of Health. And that should be posted on our website as well as circulated. We've implemented a foster care emergency licensing waiver process, including some of the background check requirements, suspended our comprehensive review activities. We have limited face-to-face contacts and activities, and I know there are some questions on this, particularly around visitation, which we can get to in the Q&A. Hopefully what we'd like to do going forward is transition to more video conferencing and other kinds of virtual tools. We've looked at streamlining the administrative review process for all child welfare purposes, including group care. So administrative reviews, such as administrative reviews for new background checks. We're allowing the use of provisional hires, and we've transitioned CPR first aid trainings exclusively to the online option. Additional things that we're working on in the contract and background check areas are in coordination with Department of Health. We're working on quarantine guidance, so this is an ongoing conversation that Luba and her team are leading for all group care facilities to help us understand better what the Department of Health expectations are and how we can coordinate for individual site quarantine plans. We've also eliminated duplicate group care fingerprint-based background checks. We're going to use previous background check results for new group care requests when the previous background check meets the federal requirements. And we've updated some contract language to allow flexibility with staffing ratios and performance-based measures and outcomes and service provision. Additionally, DCYF is looking at emergency licensing process to speed up licensing and establish some additional residential facility capacity. And we've begun work on a staffing pool to provide additional staffing resources. These might be people from school districts, college students, community members who have skills and knowledge and expertise and experience to serve the children that are in our residential facilities. So those are some of the things that are underway right now, and if I have left anything out, I'd like to provide an opportunity for Luba or for Doug or Michael or others who have been working on these things to chime in. So I'll pause for a moment. I'm not sure if anyone is trying to talk. I'll pause just for a second longer. I do see that there's a comment.
Ruben from Licensing Division. Can you hear me?
I can. Go ahead, Ruben.
So I just wanted to kind of reiterate what you said. The Licensing Division this week is looking at building capacity and doing emergency rule changes on how we can license group care facilities quicker should that be necessary. As Steve also mentioned, we sent out a communication last week that we are looking at all waivers regarding group care licensing WACs and to work with your regional licensor on that.
Thank you, Ruben. I can see too that there are some comments in the chat box that it would be helpful to be able to see this list in written form, and we do have that, so we can redistribute that. Okay, if there are no comments from other folks on the DCYF side, let's use the bulk of this time to answer questions. And I'm happy to just kick that out, the Q&A off now. Deanna, is this something that we're doing by, I know you said people could raise their hands or put in the chat box. I don't know if anyone's raising their hand. I don't know how to see that.
We can unmute everybody, Steve, and then if it gets out of control, we'll just mute those that we're hearing background noise from. So we can try to unmute everyone first and see how that works.
Okay. Okay, it sounds like we are unmuted. Is there someone that would like to start off with questions? I do want to point out that Luba has posted on the chat box that the information that I just went over, and that we do have it in written form. We have posted that on the DCYF COVID page on our website.
Steve, this is Laura.
This is Ruben from the Licensing Division. I would like to answer Lois's question in the chat box, which is what plan is in place to assist providers in receiving, purchasing health and safety supplies? Someone from the Licensing Division will be in contact with each group care provider this week to identify what health and safety supplies they need. We will give that to Jenny, our CFO, and see if we can get those supplies as soon as possible. So we'll be gathering that data this week.
Thank you, Ruben. I think, Lori, you had a question?
Yeah, thank you. Hi. Some of us have been on calls related to technology needs, and I don't really have a sense of what the department might be doing with respect to the provision of tablets, computers, whatever, within group and residential care facilities, so youth can stay connected, children and youth can stay connected to not only school, but their families, et cetera.
That's a great question, Lori. We are actually as we speak, standing up a group that's going to be project managed by Rachel Mercer here, and working with our team within this division to think about how we would enable, not only for BRS, but also for kids who are in foster placement, how we're going to enable sort of visitation and contact with families and all of these things that are going to rely on technology. So we're putting together a team with our IT folks to work through some of that. I don't have all of the answers right now. There are lots of questions around what platforms can we use and what's okay and what's not, and where are we going to get the equipment, and what about areas where we may have no internet access. Number of questions that we need to work out, but we are standing up a team to work on that.
Great, thank you. I will connect with Rachel so we have
Sure.
as coordinated an effort as possible. Thank you.
Sure.
Sorry, but that question came from our providers. One of our providers is careful about the visitation.
Okay, is there guidance? It looks like there's a question in the chat box. Is there guidance on parent-child in-person visitations for youth in foster care? So, Frank, if you're still with us, I may rely on you to give us an update on the sort of governor's office discussion. But one of the things I can say to start this off is that we have prepared a waiver request of RCWs that apply to in-person visitations for youth that are in out-of-home care, because we are looking to be able to put a hold on those and then work on these video conferencing options and get those in place as an alternative during this crisis. Frank, I don't know if you want to give us an update on where that is.
Yeah, I mean, just to be transparent, we have asked for the permission to suspend visitation briefly in order both to comply with the stay home, stay healthy order, to provide, you know, a sense of safety for everyone involved in the process of transporting young ones around our communities. And we have not received that. I think you all can understand the interesting legal landscape that leaves a lot of people in. We have local health authorities telling people that they cannot do visitation. We are telling those visitation providers to follow that local health authorities' guidance at the moment. But we are getting pressure from all corners of the legal community about this situation, and we're talking through it with them, but we have asked and are waiting for approval from the governor's office on a temporary hold on visitation. Until then, we're just trying to respond to what the local situation is as best we can, and we are hoping not to be in a position of having to enforce a lot of rules right now, but it does put everybody in a very difficult position until we get that approval.
Thank you, Frank. There's also a question here in the chat box. While we're able to provide services virtually to an extent, are BRS and TFC providers allowed to provide in-person services in foster homes or in homes during the stay-at-home period? So, Frank, I may also look to you on this one. I did not interpret the governor's. I think some of this would depend on whether we're essential services. This didn't sound like a shutdown to me in his announcement, but
no.
How are we interpreting that?
No, and I think I would need to dive more into the nature of the service being provided, but the order was explicit that services for at-risk children were not part of the shutdown order. And so if you are providing services that are helping keeping that child safe, that child healthy, that child stable, that at the moment it would be appropriate and approved activity. We are also working on, I hope it does not come to this, folks. I really hope we're not having this discussion, but just so you know, there is a decision point around identification and authentication for primary workers, essential workers in our communities. If we get to a place where we're actually checking who you are, again, I really hope that we do not get to that place, but do know if we do that we are working on a solution to provide you the authentication or ID you would need to do your jobs, whether that's going to the supermarket to get food and materials or whatever it is for your home or whatever it might be. So I really hope we don't get to that, but do know that that is on the table for a decision.
Thank you, Frank. It looks like is there a waiver in the works for child care group size limitation to 10? If a preschool class has 10 children and 1 teacher, that puts sites above the guideline, places providers in position to decide who can stay and who must leave. Luba, are you in the loop on that?
Can you hear me?
We can hear you.
Oh, great, thank you. Morning, everyone. So the group of 10 is the Department of Health guidance, and it's also a part of their social distancing strategy that we all must follow in order not to continue spreading the virus around. It's not a licensing requirement. It's not a DCYF requirement again, but it's a part of the governor effort to limit, in all of our collective effort, to limit the spread of the virus. We understand the challenges with that, and definitely there is a waiver process that's been put in place by the child care licensing, very similar to the foster care licensing. Please feel free to contact your local child care licensing office and discuss your specific situation. Because if there are space allows and you can establish 2 groups of 10 or 3 groups of 10 in your space, it's all possible to do.
Okay, Luba, this next one may be one we can benefit from your guidance on too. When can we expect the individual consultations regarding possible quarantine options, as this is the one huge area we are fearful of?
Yeah, so we are waiting for the DOH guidance, and because based on the state approach, DOH is the only agency that's supposed to provide guidance around quarantine facilities. So at the same time, we need to start establishing per site quarantine plans. And we will start doing it this week. So we will be in touch with every single provider, because many of providers have multiple sites. And we will start developing those plans based on your current accreditation. Because through the accreditation, you probably have some type of disease control plans, and we will use those as a basic and start seeing what is still not there. The biggest part of the plan, and probably you all know about it already, is the staffing plan. So we need to make sure that we have appropriate staffing pool in order to, it's what kind of Steve started with, in order to develop a backup for your staffing if some of the facilities will be on the quarantine.
Okay, thank you, Luba. The next question here, are families receiving assistance on access to technology to connect with their children in foster care via Zoom, Skype, FaceTime, etc.? That's actually part of the work that we are doing right now. So we are working with our IT division to figure out what kinds of assistance we can provide, which of the platforms will be platforms that we can use, what types of equipment we can make available to people. All of that is on the table, and we expect to have some guidance around that fairly soon, although it's a huge issue, so we're working that out. We do intend as well to reach out to the provider community and get some thoughts from them as well. And then a clarification on a previous question, just to clarify, BRS providers can do virtual visits to meet contract requirements when possible, but can do an in-person when needed to help stabilize. Is that correct? I believe that is correct, unless any of my colleagues would disagree. Okay, and then moving down further, if we're able to provide virtual services for BRS contract requirements, is that sufficient? Doug, I know you were doing some work on the BRS contract requirements. Do you want to chime in here?
I think you might be on mute, Doug.
Can you hear me now?
We can.
Can you hear me? Okay. Yes, I mean, when needed and when available, virtual, video or even conference call will suffice.
Okay, that was easy.
Yes.
Thank you, Doug. What if our agency says we cannot do home visits or see kids and families in person at all for BRS foster homes?
Again, if you can do it virtually or by phone, the best you can do in this time of crisis. We understand that there's going to be unique situations where it isn't healthy or safe to go into the home due to the virus or quarantine or whatever. And we're allowing you to do the best you can under these circumstances. You may contact whatever way possible if you cannot do it in person.
Thank you, Doug. There's a comment here that the Department of Health recommendations for foster care group facilities appear to be based on medically fragile homes. Will there be an effort to clean up that list to include those of us who do not have the plans or resources described? The checklist is hard to use as is. Luba, is this part of the work that maybe will come from some of what you're coordinating now?
Correct. We need to include the medically fragile, and Barb and I are working on it. Correct.
Okay. And then Jill May, there's a group working on technology issues. It would be great to coordinate. Repeat of what Lori just said. Just wanted to make sure you're aware. Thank you, Jill. We do want to coordinate, so we should be in touch about that. And then Rachel, our BRS foster home is being told they have to allow in-person home visits. Does the foster home have ability to say no?
Yes.
I think that, go ahead. I think that was Doug.
Nope, wasn't me. I heard somebody in the background.
Because I think that fits, Doug, with what you were just saying.
Yeah, I mean, I don't, it's a tough one because foster parents, just like our foster parents, are volunteers. I think we do have a right to see our kids if we're concerned about safety and well-being. It can't just be denied, but I understand everyone's fear around potential infection from the virus, so I can see people being a little bit paranoid about letting others into their home. Do providers have any ideas on how to navigate that with your foster homes? I think your relationship with your foster homes is vital during this time and communication with them in order to navigate some of that. Is there a way to do it to where, if they're concerned about infection or if they're infected, is there a way to do it where you stand outside, look through the window, communicate 6 feet, social distancing, come up with plans that meet, the health and safety of children, during this time with the virus and whatnot?
Right, and I don't think we have anyone from field operations on the call. If we do, please correct me and chime in. But I know that, obviously for the monthly health and safeties, we do need to continue those and make sure that children are safe. But we do have some federal guidance to allow some ability to do that by video conferencing. So we are trying to set that up. Short of having our Assistant Secretary of Field Operations on the call, I wouldn't go so far as to say that foster homes can just refuse to allow access to the kids, but there may be other ways to do that, as Doug just mentioned. What I would recommend in those situations is calling the caseworker and figuring it out, and the supervisor if it needs to be staffed, and figuring out ways to provide them with the information they need, whether it's by video or however it can be worked out, so that they know that kids are safe in the homes.
For what it's worth, folks, this is Frank. In our morning call this morning with the secretary, and there is a cabinet meeting that takes place every day now in response to this. He asked what he could do for us today, and I asked for a resolution, that the number one thing for us would be a resolution on this question. Are we going to be given time legally to pause visitation in order to work out a more graceful set of alternatives for all of you? Or if they're not going to provide it, say no, so we can provide the guidance that you just heard around and get the Department of Health involved with us a little bit more directly about this situation, about the kinds of steps that would need to be taken to do this safely, to keep everybody concerned safe. And so, you know, hand washing protocols, screening protocols, all of the kinds of things that we can do to ensure our safety. The Department of Health can help us design protocols around the different kinds of visitation that are needed. We were hoping to get a little bit of breathing room in order to do that work. But I'm hoping, and what I asked Ross to do was if he can get resolution. If they're not going to make the decision, let's not stay in limbo. So I think what we can start doing is exploring how we can do this as safely as possible under these conditions in partnership with the Department of Health, and give you all as much guidance as we can. And if those protocols cannot be implemented, then I would hope we're in a position to say that video and everything else would have to suffice. But that's kind of where we are on that whole suite of questions.
Thank you, Frank. And it looks like, Rachel, you updated that to mean family visits, which I think also is addressed by what Frank just offered. We're currently dealing with a youth that's running, and our foster parent doesn't want that youth to return due to fear. I'm worried that foster parents will not allow these youth to stay with them. We certainly understand that worry. Ruben and others working with the foster parent community, do you have thoughts on that?
Yeah, this is Ruben. I would, and that's a tough one. I would consult the social worker, the caseworker, have a conversation with them, and see if there's another placement. I would first just contact the social worker and get some type of guidance.
Thank you, Ruben. That is definitely not an easy scenario. It looks like there's a momentary pause in the chat box here.
Steve, this is Doug.
Sure.
Are you also looking at, are you going to be addressing those questions that were sent via email by Jill May, or are we going to do that at a different time?
That is an excellent question. I didn't see them.
Oh. She sent them to you and CC'd Frank, Luba,
Gotcha.
Myself, and Barb.
I
There's
see
like
them
5
now.
of them. I think some of them you've addressed. There's a couple in there that I just want to make sure that we touch on if there isn't any other questions.
I'll go through those now and then jump back to the chat box because I do see them now. Thank you, Doug.
Mm-hmm.
And thank you, Jill, for sending. So there are 5 questions here. One is maintaining health and available workforce. We're all working to ensure that our residential personnel, including support staff, are healthy and safe to work with clients. A significant threat to our continual operation of programs is running out of staff. Personnel may become ill, but more likely will be unavailable due to quarantine or an unwillingness to come to work due to perceived risk of infection or safety. This is one of the things, and Luba, I think you have some plans already underway on this, where we're looking at putting together a staffing pool And I will let you talk a little bit more about that, Luba.
Correct. So we are planning and hope to start next week an emergency staffing recruitment campaign. A number of their school district employees, as we all know right now, do not work, as well as many students who also could be interested to do this work partially kind of busy with their studies at the same time, do have additional time. So we hope to be able to recruit the staffing pool and in some way make it a centralized type of process. So each of you who may have staffing issues may actually go to this pool and hire these people as soon as possible. And one of the definitely qualification requirements from the beginning will be the minimum level of the background check. So you can bring them to work immediately, and then from there, they can transition to a necessary background check process, so additional qualification requirements if we will establish it and if we will need to do that. So this is the original plan. We do have already people contacting us and asking, volunteering. So it's kind of an idea that came from us as well as from the community of people who would like to help.
Great, thank you, Luba. The second question here is, we need a definition and plan for immediate precautions required when youth or staff test positive for the virus and a group home's environment and inhabitants are exposed. This can close a program quickly if planning and interventions are not considered and communicated before it happens. And this is part of the quarantine work that we are currently doing with DOH. Is that correct, Luba?
Yes.
Okay. So more to come on that. We do understand the gravity of that.
Hey, Steve, this is Doug. I do think it's important, we kind of alluded to it in our letter, that programs need to also have create their own emergency operating plan, and through guidance from DOH, the website, or CDC, come up with something. They shouldn't wait. They should be developing something because every program is unique. They have to develop some kind of plan. And then we can give more guidance regarding quarantine, but around, safety and health standards that are outlined in DOH. They should, if they don't already, they should have all of that in place.
That's a good reminder, Doug. Thank you. Question 3 here. We need supplies too, such as masks and sanitizer. Competing with the everyday shopper is exhausting and yields little results. Extraordinary costs are mounting quickly for us all. Staffing costs, incentives for working, devices for visitation, medical supplies, and telecommunications for our staff assigned to home. On the supplies issue, it's one of the things that we're working on on our side as well through the Emergency Operations Center. The difficulty is that a lot of those sanitizer and mask type supplies are being prioritized to the medical community, so we're even having difficulty getting them. But we are continuing to work on that. I think as well, we circulated a letter. I don't know if it's been helpful and or not, or if it's been out long enough to show any results that that's on state letterhead and states that providers are caring for vulnerable children, and hopefully that's helping folks obtain some supplies. I just don't know if that's been effective yet. In terms of staffing costs, incentives for working, we understand that these costs are extraordinary. Is Jenny on the call? Frank, do you know? Or Luba?
I don't think so.
Okay.
I don't think so.
It's certainly something that she's aware of and that we are working on as we think about how to sustain providers through this crisis and how to be fiscally responsible and supportive through all of this. I will bring these questions to her as well and highlight that for her.
I would like to clarify a couple of things, Steve, if it's possible.
Sure.
So We talked with Jenny yesterday. We explained the situation with the food and supply shortage in some particular communities, and we also explained the situation of the in amount of supply that providers may need to have in consideration with the quarantine. So this is exactly what Ruben been talking about, that someone from licensing will be in contact with you the latest Friday, asking you specific questions about your food and supply shortage and what you specifically need. And based on this list, we will coordinate kind of a centralized supply process. At the same time, I think we need all be aware, despite the fact that we are the essential workers, we are not the first responders. And we all are aware about the state shortage on some specific supplies. So we need to definitely make sure that the first responders have everything that they need, and then hopefully, as we will have more PPE supplies, they will come to us too. So we cannot definitely do what we can provide resources that state doesn't have at this point of time, but we'll hope that it will become better next week.
Can I ask a licensing question really quickly?
Sure. Absolutely.
Okay, I wasn't sure if you guys could hear me or not. So we've been working on a plan for kind of backup staffing for our agency for some of our group care programs. And yesterday I had submitted 3 waivers for different programs requesting to be able to pull staff from our adult services to be able to work with children under the supervision of staff that, you know, definitely meet the requirements and have all of this training and have cleared backgrounds. And so I was just hearing on this call that you guys are authorizing provisionals, but the feedback that I received on those waivers is that I'm going to have to submit a waiver for each person at each program they might work at, and I'm super happy to do that. It's just going to take me time to be able to put all of those things together, and I don't know how much time we're going to have. So I don't know if the provisional is newer, and if all of those separate waivers are going to be required for each person for each program that they might work at for it.
Hi, this is Pam McCowan from licensing. Yeah, because we have to track the waivers individually, they do need to be individual waivers, and we are processing them very quickly on our end, and trying to meet your needs as quickly as possible.
So individual people are still going to, so it can't just be specific to a program. It does have
a waiver is individual. Yeah.
Okay.
Thank you.
Yeah, thank you for clarifying that for me.
Okay, 2 more questions here on Jill's list, then we'll jump back to the chat box. Staffing ratios and alternative staffing scenarios may be required as we move forward. So I think we've talked about this a little bit. The one piece I'll draw out of this question here is that there's a request for a central point of contact for consideration of these issues as we get into the thick of this. We'll need answers quickly,
Steve?
and we need to know who's going to be in charge. Yes?
Steve, this is Doug. One of the things that Michael and I discussed in the last couple of days, beginning last week, as we're working through the contract changes and stuff, is we decided that there needs to be as much flexibility as possible for these programs to make decisions to staff their program. There's a lot of flexibility now going to be around staffing ratios, staff qualification, staff training. Clearly, as needed, it will be minimum licensing WAC standards. We can't approve anything below minimum standards. That would have to go through the licensing division through a waiver. But what we're looking at is, as programs, if needed, they can lower their staffing ratios, staff training, qualifications down to minimum licensing standards. that's going to be the bottom line. We want that flexibility. If they need to do that, they need to go ahead and do that. Anything below minimum licensing standards has to be a waiver approved by licensing division.
I'll pause for a moment unless Pam wants to comment on that. Make sure that we're in agreement there.
The biggest concern that we've heard is that if this thing starts really intensifying, having to try and do individual approval at a local level, are those people available to give them for all that kind of stuff can create a huge backlog that we don't want. And I think at this time of need, we have to trust in good faith that our contractors are doing what they need to do to safely serve these children in the circumstances that are occurring, and maybe changing hourly in some of those programs and having to make decisions. So that's our rationale, is trying to be as flexible as possible with the contract.
Thank you, Doug.
Hi, this is Brian Carroll. I'm following up on that last question. We had a conference call yesterday with residential providers that are part of the association, had huge participation. And this particular issue that we need to know which person in our region or which person from headquarters is going to help us immediately when we end up with a quarantine situation. If this happens at my agency this afternoon, I have no idea who to call to get answers right now for what I have to do. And that's what we need. I think on an emergency basis, it's the single most important thing that the provider community was talking about yesterday. Feeling like we have to have immediate consultation as a quarantine situation may pop up. None of us know who we're supposed to call. So if we could clarify that today, it would be really, really helpful.
Yeah, this is Doug. You call the regional BRS manager, or if it's a different contract, whoever that gatekeeper or lead is for that contracted service. But the regional BRS managers typically are the ones that you should contact, and then they're going to triage and pull in Michael or myself and local licensing folks to triage your request. Is that helpful?
It's not the answer that I was hoping for, but it's maybe helpful. What if it's 7 o'clock at night? What if it's 1 o'clock in the morning? Those things maybe aren't going to happen.
So we need to identify an after hours individual or individuals, someone in after hours to also triage.
And someone that can tell us what to do in real time rather than start the process of waiting for approvals and doing things like that. We got to plan out possible scenarios, get some consultation, and get some immediate direction.
Are you, Brian, are you talking about like lowering staffing ratios to whatever you need, or is it something more around the quarantine, around how to handle that piece?
If it happens in my group care facility an hour from now, where we have an actual outbreak or enough exposure that quarantine is what's appropriate, then what happens? Do the staff quarantine at home? Do you bring new staff into the exposed environment? How do we staff immediately? Do you look at the, protecting the environment with the exposed person? Just what is the scenario going to be? Because if you go to a 14-day quarantine, or if that happens at home, then you immediately have lost your staff team. and people who are employed, you know, the big deal is making folks feel like we got enough of this situation handled that they can keep coming to work and be assured that things are going to be safe and healthy enough for them to come to work and protect their own family. So, you know, the things that the providers identified around running out of staff is that very issue, that if we have to quarantine and deal with those kind of immediate issues, I mean, it's going to be really immediate. What do we do right now? And we have to have somebody to turn to that can help us through that process, because it's coming really fast, I think.
So I can give you a general perspective. It's Luba. It all depends on how big your facility is. If you have a residential facility and you have someone who been tested positive, then it means that this particular facility as a whole will be on a quarantine, which means the children who live right there will stay within the facility, and then you will have to make decisions for the staff. Would they quarantine at home, or if they will be willing, they can also quarantine within the facility and continue to serve children if it's possible for them to live in the facility. If it's not, then they will have to go home and be quarantined at home. And then we will need to bring additional people to serve the children at the quarantine facility. This is how we understand DOH guidance. This is why I'm saying we are waiting for the more specific guidance from DOH for this particular cases. If you have a big facility, so then it doesn't mean that every single child and every single staff member had a contact with someone who been tested positive. Then it means that hopefully you can establish some part of the facility on quarantine and another part of the facility outside of quarantine, or maybe we can move children to a different facility who be not exposed. So those things will go case by case. It's why I agree with you, we probably need to establish like a quarantine hotline. And if those situations happening at any point of time during the day, we will have someone who will be able to assist a provider who is facing this particular situation.
Hi, this is Lee Stila from Region 4. Anyone hear me?
Yes, we can.
Oh, thank you. I'm sorry, I just got disconnected, so I didn't hear the response, the complete response after Doug to Brian's question. And I'm the BRS Program Manager Supervisor in Region 4. I'm sorry, could you repeat the answer?
At what particular point, particular part you didn't hear?
Well, Brian was wanting to know who to contact in case of a quarantine issue that could happen, you know, any time of day.
So Doug suggested to contact the regional BRS manager, and the regional BRS manager will triage the answers, the questions and answers.
I have a concern about that, and that is this really is a medical health issue, and we're not medical people in the region, and I don't think contacting the BRS program manager is necessarily the best place to start.
So that sounds like something. This is Steve, if I may suggest, also because we're getting close to the end of the hour here, that might be something we need to continue to work on and as quickly as we can. Luba, in our sort of coordinating group around quarantine and how we're going to take this forward.
Great, thank you.
Yeah, I think quarantines are separate from program staffing needs or issues. And I was addressing program staffing needs and issues and flexibility there. That would be the program manager, regional program manager. Is a great question about after hours stuff. But quarantine, I think, is a very different specific issue that I do think what Lupa alluded to, that there might be an identified quarantine lead or staff person that would be the contact. We need one for business hours and after hours. So we need to set that up separately and separate type of contact.
Yeah, thanks for the clarification, Doug. Yeah, I mean, and I think licensing, as far as the first contact for staffing issues, licensing obviously plays a key role in that situation. And we can't give, BRS program managers cannot give the approval for, the licensing requirements, changes in the licensing requirements or not requirements.
Yeah, I think we need to continue this conversation separately. One of the things that we absolutely need to build in within DCYF is making sure that we, wherever the contact comes to us in terms of the team, whether it's regional BRS, headquarters, licensing, that we take an active role in helping to facilitate getting folks to the right place. And so that will require some of the behind the scenes work, and that's the work I think that Steve was alluding to us needing to continue.
Yep. Thank you, Barb.
And I think the consult getting back to us after, you say that you're meeting with, getting direction with DOH really quickly is going to be really, really important, because the response to Brian's question that was on behalf of many providers doesn't really answer it. If quarantining in a group home is the answer and the staff aren't willing to quarantine, then the answer sounds like we're left with asking healthy staff to come be exposed. So we're going to need more guidance on that, please.
I agree.
Thank you. That's noted, and we'll be discussing that further.
Thank you.
It looks like we have about 3 minutes left here and a number of questions left in the chat box. Deanna, maybe something that we can do is the ones that are left that we don't get to by the end of the hour, we can answer by email and circulate to attendees. I don't know if that's a way to handle some of these. Some of these are about, there's a staff pool for possible coverage, I believe is where we left off. And I'm appreciative of this effort, but the immediate concern is about increased staffing costs, so that's something I can take to Jenny. Background check process modified for residential care providers or also prospective relative suitable person caregivers. Is there a quick answer to that, Ruben or Luba?
The waiver process is applied to every type of provider, not only group home providers.
Okay, thank you. There was a bit of an echo there.
This is Pam. Children are placed with the name and date of birth frequently anyway, and then we follow up and complete the background check. So I think that process would continue.
Okay, there's another question about waiving the 1-year direct work with youth for direct care staff. These would be those that have high school degree or higher. I don't know if that's been discussed to that level of detail, Luba.
This is Pam. We are looking at all waivers, so if anybody has a need, they are welcome to submit a waiver, and we will work through that process with you.
Quarantine information as quickly as possible. We need to clarify we do not need additional approval as long as it meets minimum WAC standards. Can this come out in an email? We can certainly work on that. What supports are in place for foster parents whose children are in foster care? Is DCYF helping connect them with counseling? Just thinking of those parents who may have addiction issues and how the forced distance may cause them who are trying to get it together to begin using again. Very good point. One of the things that we're working on with our service providers is how they can also provide services to the extent that they can in remote ways, either by telephone or video. We would like to, so in terms of services for parents, we'll be working on those types of things as well as the ability to maintain contact with children by video so that they can have at least some kind of contact, and also by telephone. Foster parents need guidance from DCYF around in-person visitations. I think we've talked a little bit about that on the call. Can they refuse those to continue? Some visitation agencies and social workers are making foster parents feel forced. And we did address that a little bit earlier. Josh, if you'd like to talk offline, we can certainly do that. I'll reach out to Deanna for your contact information. Anything else that we need to throw in before wrapping up here? Because I know we're right at 10 o'clock.
This is Senator Darnielle. Can you hear me?
I can, yes.
Thank you. I wonder if you can provide any guidance to foster parents or home providers about how to talk with children about the emergency, and if they're finding that children are really understanding how dangerous it would be if they ran, or how important their health and safety and well-being is to all of us here in the state, and that we're trying to, we know there's change, we know there's urgency, but putting their feelings out and helping to talk through this issue with them.
Senator, I think that's a very good point, and something that we can certainly take forward in working with our CPAs and other folks that are on the front lines with foster parents. I don't know if anyone from licensing wants to, if you've already started something like that, or if there are other thoughts on that.
Yeah, this is Ruben from Licensing Division. We are actually are meeting the last couple of days about our kinship caregivers, and we'll be sending out a message to them, and we will definitely include some guidance on how to talk with foster children about the COVID-19. That's a good point.
And if I could just make one additional comment, I know that these are very, very desperate times and very uncertain in so many ways, and there are so many children who are fragile and at risk that are in the care of all the providers. And I just wanted to say, I'm getting a little emotional, but I appreciate the work you're doing. And we could not make this world safer for children without all of you. And so just a word from me that I just honor you and appreciate everything you're doing. And thank you so much for helping us weather this very uncertain time. Thank you.
Thank you, Senator Darnielle. That's actually a fantastic way to wrap up the call, and certainly all of us from DCYF echo that sentiment. The work that you're doing right now is incredibly valuable, and we know it's very stressful. We want to be as flexible and supportive as we can during this process. For those of you who had questions in the chat box that did not get a response on the call, we'll try to pull those together and write out a response for you and circulate those. Deanna, did you have other, or anyone else from DCYF that needed to chime in before we close?
Hi, Steve. This is Deanna. And I just want to make sure that if anyone does have any questions once this webinar ends, we will definitely create a list and send back out some responses to that as well. And we will be sending this recording out after this call. In the chat box, you'll notice the emails to email if you have other questions, as well as you can go to the COVID page on our website for a frequently asked questions. I noticed some people suggested that we continue to have these. We can definitely talk through that internally, and we'll send out another announcement.
Great. Thank you, Deanna, and thank you everyone on the call. Again, very, very, very grateful to all of you for your flexibility during this time and your commitment to children and youth and families. So thanks, everyone.
Thank you.
Yep, take care.
Thank you.
Thank you.